Hi there, this is Lori Edge-Hughes, and this is your 4-Leg Rehab Minute. And in today's minute, I want to talk about PRP, when it makes sense and when it doesn't make sense. Okay? I've seen and heard a lot of things that I'm like, where it's being used sort of like when the only tool you have is a hammer, the whole world's a nail scenarios. So let's start with what makes sense. First off, what does PRP do? So it causes the release of growth factor and cytokines, okay, and that can stimulate inflammation, and in doing so can help with healing. And the other ways it helps with healing is stimulating cell proliferation and collagen production, can help with angiogenesis, regulates inflammation, and that's what I was saying in regards to you need some inflammation in order to set the healing started, so then the inflammation can go away, and subsequently it can reduce pain. So the number one use in the literature, human, animal, otherwise, is for osteoarthritis. That makes sense. Okay. Now, mixed results for tendinopathies and those sorts of things. So let's just then keep with joints for a minute. Now, what I've heard and seen that I don't think makes sense is PRP for a juvenile dog with hip dysplasia. Now, if this is a shallow socket or things are way too loose, what are you hoping to get out of that? Like maybe some short-term pain relief, but there's likely other ways that are less expensive, less invasive, and can have a bigger long-term effect, like doing your rehab and doing some exercises and modalities plus exercises can likely have a bigger effect. So I don't think it makes sense there. You could argue that, well, sometimes when the dog becomes suddenly lame with hip dysplasia, it's because things have been too loose and there's a creation of a microtrauma, microfractures in the acetabular rim. So the PRP might help stimulate that to heal. Okay, well, so could rest. Okay, so next one. PRP at the time of your cruciate repair, your TPLO, extra cap, TTA, whatever. Okay, now you've got your joint that's already big and thick and swollen, lots of blood flow going in. So you dump in the PRP, it's likely gone. That blood flow, it's likely gone. Two, you are not supposed to incorporate non-steroidal anti-inflammatories with PRP. It makes it less effective. And you had better well be giving that dog some non-steroidals after its cruciate surgery. So it doesn't quite make sense. Maybe later on down the road, sure. But at the time, it doesn't quite make sense. PRP for a full cruciate tear. Again, what are you hoping? The ends aren't talking to each other. So why are we doing this? And there's already inflammation in the joint. Why? If it's a partial tear, you better know if it's a partial tear, if it's a full or partial tear of the cranial medial band. If it's a full tear of the cranial medial band and only the caudolateral band, yes, of the cruciate ligament, cranial cruciate ligament. If only the caudolateral band is still intact and the cranial medial is gone, you can't make that guy grow together. That's the guy that will prevent this from becoming a full tear within 2 years. So you're likely not gaining anything by PRPing it at that point. Okay, and lastly, PRP for a displaced OCD lesion. Why? It's not going to make that OCD lesion suddenly go, oh, here I go. It doesn't happen. So, okay, these are things I've seen. These are things I've heard. These are things I've had to counsel clients where they're like, well, I've been told maybe I could try PRP. So, okay. So now you can know better so that you can help advise and we can grow the state of knowledge and see where that goes. Okay, good luck. Until next time. Cheers.